Have you ever had a patient come back frustrated that their symptoms haven't improved? Despite doing everything right, they've taken the medication as prescribed, they've followed your nutrition advice, and stuck to every guideline perfectly, yet they're still struggling. Maybe it's your patient who's been on a PPI for years but still has reflux, or the one with IBS who feels like their bloating will never go away. If you felt stuck in these moments, you're not alone. The conventional medical model is incredible at treating acute illnesses. You break a bone, we set it. You have an infection, we prescribe antibiotics. But when it comes to chronic issues like gut problems, fatigue, migraines, conventional medicine often stops at symptom management rather than asking, why is this happening in the first place? That's where functional medicine comes in. Instead of just treating symptoms, functional medicine seeks out the root cause, digging deeper into diet, lifestyle, and biochemical imbalances that could be driving disease. But is it all evidence-based, or is some of it just expensive hype? That's what we're unpacking today. I'm Colleen, a PA, dietitian, and your nutrition mentor. Welcome to the Exam Room Nutrition Podcast, your guide to giving better nutrition advice. Today, I'm joined by Shefaly Ravula, a PA and the visionary founder of Precision Gut Health, a virtual telehealth practice dedicated to gut health, metabolic balance, and longevity. She combines culinary medicine, functional labs, and evidence-based digestive health strategies to help patients achieve long-term health without just relying on prescriptions. With a background in both conventional gastroenterology and functional medicine, Shefaly has built a career bridging the gap between these two worlds, and she's here to share what she's learned along the way. In this episode, we're unpacking the biggest misconceptions about functional medicine, the labs your patients actually need but we often overlook, and how to help patients with gut health complaints without just throwing a PPI at them. So if you've ever wondered whether functional medicine is just a fancy rebrand of wellness trends, or if there's real science behind it, this episode is for you. So grab your coffee and enjoy my conversation with Shefaly. Well, hey, Shefaly, thank you so much for coming onto my podcast. Welcome to the show.
Thanks so much. Excited to chat with you.
Oh, I can't wait to get into this topic. This is such an important topic that not a lot of clinicians know about because we're not really taught it in school. So I would love if you can just give us a good definition of what exactly is functional medicine.
Functional medicine is more of a philosophy than it is an actual specialty, if you will. So it's just thinking about medicine in a different way. So, thinking about the root cause of the problem. I always say to people that I've got a line here and this is sort of day zero or whatever, or point zero. And going forward is, more conventional medicine where we're trained to think like, okay, we've got the diagnosis, that's zero. What do we do with it? What are the medications? What are the referrals, et cetera? So we're kind of thinking forward like that, which is fantastic and necessary. But we like to also go backwards and we're trying to find, okay, why did you come up with this diagnosis in the first place, or a symptom? What drove your body to develop this phenotypically? And then we also do the forward piece. So it's a lot of work. It's time consuming. It's evidence-based for sure. I think there is a misconception out there. And I was definitely one of those when I was trained in conventional school 25 years ago. We had this training and we had this thinking that our way is the only way, when there are ancient philosophies and medical philosophies around the world that have been in existence for centuries. They just didn't have evidence behind them because they couldn't do evidence-based medicine.
I'm glad you mentioned that there are misconceptions because I've seen that. And I'm curious as to what are some of the bigger ones that either your colleagues or maybe even some patients have come to you about the misconception about integrative and functional medicine.
One of the big ones is that we're not evidence-based, but you dig into the literature, there's plenty of evidence. But that being said, some is not evidence-based, and it's, we are to treat the patient in front of us first and foremost. So if the patient is in front of you telling you, this Bentyl or this antispasmodic is not making me feel any better, or I still am bloated, or I don't want to be on a long-term heartburn medication and I'm constantly belching and burping and I've done the foods that I'm supposed to do, or, I'm on 4 migraine medications that the neurologist put me on, but they're not working. And, at that point, we have to listen to our patients. And if we don't know the answer in the conventional field, we have to be frank and say, we don't really know, there may be other things out there, but I can't help you. So that's one misconception. And then the second one would be the supplement thing, which is huge. And yes, there are a lot of supplements out there. And no, they're not very well regulated. Correct. Yes, you can find functional medicine practitioners that do a ton of supplements, brand their own, all that kind of stuff. And that can be really I'm sure, very that doesn't seem right to me as a conventional practitioner. So I understand that, but I also, you want to be thinking about a food first approach is where I like to live. So food is medicine first, but you can't easily start there if you've been exposed to the world and the standard American diet and stress and poor sleep and all the lifestyle factors that we've all been exposed to our whole lives. And then all of a sudden be like, okay, yeah, you're going to have a food as medicine approach and that's going to cure you. It's not easy to get there. It's doable, but I think sometimes people do need a few supplements to help clean up their gut or help speed up the process. But in the end, I don't think anybody needs to be on long-term laundry lists of supplements.
No, I really appreciate that you mentioned that there are some practitioners who have a wide range of supplements and tinctures and all these things that can cure all your problems. And I think that's where the red flag should go up as consumers. If there, is an essential oil that's going to cure their migraines and constipation and fatigue and headaches, I don't know if that promise is a little overarching and if we can just kind of tone it back. So I think that's where a lot of people get hung up with oh, functional medicine is all just woo woo. It's fairy tale stuff. It's just wishful thinking that I'm wasting my money. On the flip side though, if conventional medicine isn't working, like you said, we need to investigate for something else.
Yeah. There ought to be a very blended approach. You've got gallstones and acute abdominal pain. I'm not your person. You've got to have a conventional approach really for everything first and foremost. Of course, it's also covered under insurance, so that's great. But after that has been exhausted and the person is chronically ill or has a chronic long-standing complaint that they're living with, that they just think they have to live with, or that they're aging, these are things that where, really I think the functional medicine and functional nutrition approach are really important drivers of change in the long run.
Well, I really appreciate that you take a blended approach because I agree with you on that. I think that it can be a beautiful marriage between traditional medicine and functional medicine. So I'm curious as to what can you tell some providers that are listening that are yes, this is my jam. I'm so interested in this. How can they start to combine the two when they are practicing with patients?
I mean, a good start is lifestyle medicine. So lifestyle medicine is now, as you probably know, you can get board certified in lifestyle medicine. That's the foundation of functional medicine. But I think practicing some lifestyle medicine is a great start. And that's what I did. I first started with, in my GI practice, trying to just start talking about food and fiber and polyphenols and, cooking. And I talk about stress, but, I didn't have much time, but that's where you can start with is those, those lifestyle tenets. So stress, a big one, sleep, a big one, movement, a big one, food and nutrition, a big one. And, those are kind of the pillars to be thinking about. So hopefully that's helpful.
That is very helpful. And I love that you mentioned those pillars because in Western medicine, we're so quick to, you have this problem, here is this medication, or here is this treatment, instead of taking a step back and wondering okay, how is it going with your sleep? Are you moving your body every day? What other things can we suggest, maybe with food, that you won't have to write a prescription for? And I think that's a really, really beneficial style of practicing medicine that our patients would benefit from significantly. So I want to move into some nutrition topics here because this is your wheelhouse with gut health and nutrition. So I would love to hear just some foods that you are recommending all the time to some of your patients and why.
Okay. So that's really tough because I am in the field of personalized medicine. So people come to me for that very deep one-on-one individualized care. There are some general terms that I think benefit most people. And I like to think of things that you exclude and things you include. And I usually start with include first for people that, can't necessarily afford to go see somebody like me or a dietitian or, someone that's really going to hone in on that. So maybe instead of worrying about removing certain things from their diet, obviously I would love for everyone to be off of sodas and high fructose corn syrup and poor quality, high amounts of saturated fats and yes, all those things. But really working from the premise of the Mediterranean diet is A-OK. We have a lot of data behind it, and there are components of it that make sense. So including things like fiber, lots of fruits and vegetables, olive oil, including protein, including those things help, because what that does, I think, is when people are satiated with fiber and protein and other fruits and vegetables, they tend to displace the calories and the foods that they would have chosen because they're full. I mean, this is not for everybody, though. Not everybody has satiety. Lots of people have issues with satiety hormones. Lots of people have metabolic adaptation problems with chronic obesity. So that's not for everyone. But I think generally parts of the Mediterranean diet or the concept of it is very valuable.
I really love that you take that personalized, individualized approach, because I say this on every episode is like, nutrition is so nuanced. And I really appreciate that you didn't give me like a list of 5 foods that you tell every patient to eat, because in reality, 5 patients might not be able to tolerate those same 5 foods. So the human body is so interesting and nutrition science is fascinating. So I really, really love your approach to nutrition and medicine, because I think that's the best way.
And I'm going to just tag on to that. One thing that we do in our practice is nutrigenomics. And it's just fascinating. It's cutting edge science. There's still a lot we have to learn about these SNPs and whether we can do anything about them. But, the idea that they're not a make it or break it type of test, in my opinion. It's more about people will do that test if they're very interested in their DNA and how they can maybe make some epigenetic changes with their food and maybe even certain supplements. But then sometimes the DNA is not very helpful. But I was just going to think of one example, and this has nothing to do with anything related to having a positive or negative outcome, but the TAS2 receptor gene is like the bitters, right? The people have that gene SNP. They cannot tolerate bitters. And we have to be creative in terms of how we incorporate bitter foods for them, because bitters are so good for the gut and for the gallbladder and, just general health. So for those people, I'm like, okay, we might caramelize your vegetables. So it's just fascinating because the world of nutrigenomics is really cutting edge and fascinating, and has to do with even a more deeper dive into individualized nutrition.
I think that is so fascinating. And, I sit in the pediatric space, and vegetables around all kids are a tough food. And I really think it has to do with the bitterness of it, because they all traditionally tend to love fruits because they are naturally sweeter and juicier. All right. So let's bring it back to gut health, because I would love to hear what you would tell a busy provider who's in primary care. How can they educate their patients, or maybe help the patient that's sitting right in front of them who's having some digestion issues? Like, what simple dietary changes can they tell that patient to make right now that would help their digestion?
I can't give you really general advice, unfortunately, but I will say ask the questions. That would be better than solving the problem. Make the patient think about, is it that they're more bloated? Are they distended? Did their pant size go up? Are they having the bowel movement? How many times a day? Is it a formed stool? Is there undigested food in there? Are there greasy stools? How's the stress? The stress obviously drives the nervous system of the gut significantly. Is there time for relaxation? Are people utilizing their autonomic nervous system in the division of the parasympathetic and sympathetic? Are we overdriving the sympathetic nervous system, which then drives the gut? Do some food diaries, have the patient do a 3-day diet recall. They're writing everything down. I mean, a free tool, it's a pain in the butt, but a free tool is the Chronometer app or MyFitnessPal. And you can really see how much fiber are you actually taking in. I mean, most people are not, maybe 10 grams. Same with protein, very deficient, especially midlife onwards, men and women, where that's really important. The fats, like you'll see a discrepancy in the quality of the fat that we're getting in. Calcium's often low, iron's often low. You can then follow up with labs, like nutrient labs, if you wanted to spend the money on that and really do a deeper dive. But I think in conventional practice, have them do a diet recall and see, like, just work on that.
I love that you say to answer a question with a question, because we feel the need to just come up with an answer because we're trying to give advice and we want to help. But I often say, if you just pause and wait and ask another question, you're actually going to get the answer from the patient, and that can guide the conversation and your recommendation so much better than you just saying, oh, well, just eat more fiber, just drink more water. They might be already doing that stuff. So those recommendations are not helpful at all. So I really love that piece of advice, is to dig deeper, ask more questions. Now I want to linger here. I want to pick your brain a little bit because I want to dig into reflux, because I think most of my providers have a fair understanding of constipation management. But I think the second most common thing that adult patients come to clinic with is the feeling of acid reflux. And so I'm very curious as to what are some dietary approaches that we can suggest, or even questions that we need to be asking the patient in order to help them, rather than just jumping to prescribing a PPI or an antacid medication.
Yeah. And this is where it's very controversial between conventional GI and functional GI, and conventional medicine and functional medicine, because of the concept of hypochlorhydria. I was extremely resistant to learning about hypochlorhydria as a cause of basically gut dysfunction and even the symptoms of heartburn. It doesn't make sense intuitively to think of, like, well, okay, why would the person have these symptoms if they actually have low stomach acid? So it's controversial, but I'll just explain by telling you what functional medicine and functional nutrition both teach is the 5R approach to gut health. And it's a process of removing pathogens, re-inoculating, repopulating, repairing the gut mucosa, et cetera. So there's like these 5Rs. But replace is where you're replacing certain digestive enzymes and even stomach acid. And that's not something that should be taken lightly. And so if you don't know if the person has gastritis or a history of peptic ulcer disease, you have to tread very carefully with the approval of the patient's gastroenterologist. So, because you don't want to be introducing things like stomach acid to somebody that really should not be on it. So that's one word of caution I have for anybody that's practicing functional medicine or functional nutrition on patients. So to answer more of your question about the acid reflux. So I think, it's very easy for us to go and prescribe the PPI because, one, we want to give them symptom relief. It's much like what you were just talking about. We just feel, we're trained. Our mindset in medical training is like heal and treat and fix. And it's not always that simple. We can't do that in 20 minutes or 30 minutes or even in multiple visits, right? Now, PPIs have indications for them for sure, and certain people need them. And, we worry about Barrett's and we worry about other things related to chronic GERD. So we have to be mindful of all of those things. But first and foremost is, the basics, like certainly all the GERD treatment that we all already know about, which is, reduce tomato products and spicy foods and et cetera. And then decreasing some weight usually can help. But we really need to start thinking about what's driving that lower esophageal sphincter in the first place, to relax too much. So after the conventional GI approach is completed, that's when you can start safely doing the functional approach. And so that's when you're going to start thinking about that full 5R approach. What's the microbiome like? Is there dysbiosis? Is there low stomach acid? And what's happening in the gastric lining where we're not digesting our proteins? And so we may have low stomach acid because of that or due to that. So it's not quite straightforward. It's very nuanced in terms of what we can do other than those, like, I think, Band-Aid approaches. And Band-Aid approaches include the PPI and the foods because, that's just a Band-Aid. Getting rid of the spicy food, getting rid of the tomato foods is also a Band-Aid. Ultimately, hopefully we get to a point over time that we can actually get healing that lining, slowly taper off the PPI based on the approval of the of your GI doctor and then work on downstream gut health to help upstream gut health.
Nutrition questions are so hard to answer. So I appreciate your transparency in the challenges with answering these like very specific questions that it really does depend on the patient. But in your practice and in your experience, would you say that all patients with GERD would benefit from no tomato products, no citrus products, no spicy foods, no peppermint, the kind of blanket 5 things that we suggest? Or even is this should we take a more tailored approach with even those few things?
I think those are just Band-Aid approaches, and that's fine. And that is taming your acid reflux. That's okay. You may want to dive deeper and figure out. The other thing is, I really still don't want anybody on long-term PPI, a few exceptions. And here's a question for you. This is what I saw in our adult practice in GI. People, once in a while come in the office and people say, oh, I take apple cider vinegar and it makes me feel better. I take it every morning and I feel good. My digestion's great. That would happen. And I'd be like, wait, what? I was like, this doesn't make any sense. That you would think that would make you feel worse with like possibly heartburn and, but these people swear by their apple cider vinegar. And so you think about that's acid. Or they swear by lemon water. They love to drink warm lemon water in the morning. It helps their digestion. Ask the questions. What is it about your digestion that you like? What are you noticing? Because that just makes you wonder about how that acid is helping everything in your GI tract downstream. Of course, hoping their endoscopy is okay.
Nutrition is so interesting, and our human bodies are just amazing. So I'm curious as to how do you help patients who are really busy, but they really want to improve their nutrition? What kind of recommendations and suggestions would you provide for that patient?
Yeah. So meal planning, outsourcing, I think that's key. So if you're busy, is there a way that on the weekend you can meal plan or outsource the meal planning, depending on what funds you can allocate? So you could outsource your grocery shopping so that you get something like Instacart or Amazon Prime. Then you can outsource your actual meal plan service. There are so many companies out there that do like a meal plan that you subscribe to and you get the shopping list and you get the recipes for the week. So some of that can be outsourced. And then you can go all the way to the top tier, if you will, of outsourcing the personal chef. And yes, that sounds crazy. Like, what a luxury. But we spend a lot of money on frappuccinos in the mornings and a glass of wine when we're out with friends. And, maybe some of that can be allocated to the personal chef that cooks for you. If you sit down once a week and you have a cup of coffee Sunday morning, plan out your meals. I'm in a cookbook club and that helps me a lot to keep things interesting. We cook from a book every month, or you can use free websites, the food world is amazing.
That's really helpful. And I actually have never heard someone recommend, joining like a community. And I think that is a really smart way to sort of motivate yourself and stay accountable, because we all like to do things in community. We like to do things together, and it feels like less of a task. I think when you have, a bunch of gals and guys around you, talking about what you're going to make for the week, and maybe even some hacks for if you are, stressed. My favorite is a crock pot and those microwave in a bag veggies, or, microwave in a bag rice. On quick nights, I can throw together a meal in like under 10 minutes, thanks to the convenience that those do afford. And so I think that's a really, really helpful suggestion. I love that.
And sheet pan dinners are also and you can make them for different diets in the family, because you can do like one sheet pan that has the meat, one sheet pan that has the vegetables. Sauces are also key. Like maybe you just batch your sauces on Sundays. Maybe you make a yummy chimichurri and a couple of salad dressings, and that lasts for the week. So then you have a boring like chicken breast that you just, baked or even purchased, and you have your homemade chimichurri.
Okay. Earlier you had mentioned some labs that, can be deficient due to the standard American diet. And so I know that labs can be endless. And in the functional medicine world, there's like thousands of labs that you can check. But speak to my primary care providers who are just interested in helping the patient. What are some specific labs that they can monitor that we are often overlooking?
Oh, I love this question. Some basics like, okay, so at a usual annual, it used to be a CBC, CMP, TSH, maybe a vitamin D, a UA. That's pretty much it, right? We don't often look at a CRP. I mean, that can tell you a lot. HSCRP or regular CRP. And that's the CRP alone is a cheap test, but the HSCRP can be costly, but it can be covered. If you go to Boston Heart, at least a long time ago, Boston Heart and Cleveland Heart gave you a list of their different cardiac inflammation panels. So metabolic panels, not only lipids, their insulin resistance score, their A1C, their fasting glucose, fasting insulin, they all gave you like an idea of what codes would cover. So vitamin D, and then definitely advanced lipids. I mean, cardiovascular disease is number one cause of death in the world. Number one, still, men and women. So why are we not getting advanced lipid panels on people when they are covered by insurance? Because, LP little a, like ApoB, these are important markers. LP little a is not uncommon and it's a big genetic driver. It's also a risk enhancing factor in the guidelines. So, we should be doing those on people much younger. We wait too long.
Very good point. What are your thoughts on screening for like micronutrients like calcium, magnesium? Obviously, iron is pretty standard. It's in the CBC. You think we should screen for those?
Yes, I do. I mean, I have a patient that's got diagnosed with hemochromatosis, which is not an uncommon condition that we would see in GI. We got referrals for elevated LFTs, and part of your diagnosis labs would be to get iron panel on somebody with elevated LFTs because of the hemochromatosis. My patient that I have right now, she's so upset with the conventional system because no one ever did an iron panel on her because that's not normally done at an annual physical. So she was like having fatigue and some joint pains and only in her, I think, mid 40s and had normal CBC, normal LFTs, et cetera, and was passed around. So I think it's an inexpensive test to do an iron panel and it can be covered. In terms of other micronutrients, I think those are going to be more expensive and not covered. So, magnesium levels, zinc levels, copper levels, I think those are important things to look at. B vitamins for sure, like such a deficiency in specific ones. And then those, have to do with things that are cellular processes in the body. This is where functional medicine shines on biochemistry, looking at methylation and looking at the homocysteine pathway and really like important things that we can be deficient in because of our life, but also maybe our genes and also our exposures, just this concept of allostatic load, this load that's put on your body that your body can handle. And then at some point it's like tipping the bucket and then disease manifests.
I really love that functional medicine is that holistic picture and that whole body, whole person approach to care, prevention, and treatment. I think it's just so fascinating. Shefaly, this has been such a really unique and interesting conversation. I would love for you to share for my listeners where they can learn more about you or just hang out with you online.
Sure. Precision Gut Health is our website. It just occurred to me since we ended up talking about the cookbook club that there is a how to start your own cookbook club guide on our Instagram page. We're at Precision Gut Health. If you are a provider and you have any questions and you're a listener of Colleen's lovely podcast, I think you're doing an amazing job for people. This is such a much needed area. I think it's just awesome that you're doing what you're doing. So I appreciate being a guest here.
Thank you so much. I've just appreciated learning so much from you, and it's so fascinating. I can't wait to see what you do and all the people that you help. So thanks so much for your time.
Thank you. Bye.
All right, now it's time for my nutrition notes. Now, even though I'm a dietitian who's pretty knowledgeable about nutrition, there's still so much I didn't learn in school about how to help patients beyond symptom management. And that's exactly why today's discussion was so important, and I loved it. So I wanted to expand a little more on what we talked about. I wanted to clarify the difference between functional medicine and integrative medicine because they're sometimes used interchangeably, but they do have slight differences. So both functional and integrative medicine take a patient-centered approach, focusing on lifestyle factors, nutrition, and root causes rather than just treating the symptoms. But integrative medicine brings in a broad mix of complementary therapies. Think nutrition counseling, cognitive behavioral therapy, acupuncture, yoga and meditation, and other stress reduction techniques. alongside conventional medicine treatments. It really blends traditional and holistic care. Functional medicine, on the other hand, is much more root cause focused. It dives deeper into biochemical imbalances, gut health, and metabolic function, using advanced testing to guide personalized treatment plans. A great example of how functional medicine approaches care differently is the 5R protocol from the Integrative and Functional Nutrition Academy, or IFNA, which is often used for gut healing, and Shefaly briefly mentioned it. But I did some digging and I wanted to share an example of what it looks like in practice. So let's unpack the 5Rs. First, remove. You're going to take out what's damaging the gut. Think processed foods, common allergens, artificial additives, excess added sugar, and unmanaged stress. The next R, replace. We want to support digestion by adding in missing nutrients and possibly digestive enzymes. Step 3 is re-inoculate, where we restore balance by incorporating pre- and probiotics. Step 5, repair. We strengthen the gut lining with targeted nutrients like L-glutamine, omega-3s, and zinc carnosine. And last, step 5, rebalance. Support overall health with stress management, quality sleep, movement, and time outside. Now, Shefaly talked a lot about identifying the root cause, and that's where functional medicine shines. Many of the chronic conditions we see today stem from a mix of factors. So the IFNA created the STAIN model as a framework that functional nutritionists can use to map out how different imbalances contribute to disease. So for example, if someone develops an autoimmune condition, here are some possible contributing factors using the STAIN model. Number 1 is stress. So we know that higher stress levels can worsen autoimmune-related symptoms. Number 2, toxins. Environmental exposures like heavy metals may increase one's risk. The A stands for adverse food reactions. We know that certain foods may be a trigger. I is infections, and N is nutritional deficiencies. Malnutrition can weaken anyone's immune function, making us more susceptible to disease. So at the end of the day, functional medicine isn't about rejecting conventional care. It's just about expanding our toolbox. We need both acute care solutions and long-term root cause strategies to help our patients truly heal. So if today's episode sparked some curiosity for you, I'd love to hear your thoughts. Are you already incorporating functional medicine principles into your practice? What's working? And what challenges are you facing? Shoot me a DM or tag me in a story on Instagram at Exam Room Nutrition. And if you want to learn more from Shefaly, be sure to check out the show notes for a lot of helpful resources. Well, that's it for today. Thanks for hanging out with me, and I'll see you next time on the Exam Room Nutrition Podcast.